Hello, and welcome to the online graduate research practicum form for spring 2017. My name is Mark Meyer, and I will be your presenter today. I'm a graduate student in the Masters of Science and Interdisciplinary Studies program in the Department of Occupational Workforce and Leadership Studies at Texas State University. The title of my research study is Medicare and Medicaid Health Programs. Some background information about my practicum. I chose Hope Clinic, a nonprofit in Austin, Texas, for my practicum site. The address is 8101 Cameron Road, Unit 101, Austin, Texas, 78754. In the past 10 weeks, I have been working close with Hope Clinic, which is the nonprofit organization, on gathering information on Medicare and Medicaid assisting programs for those who can't afford healthcare coverage. Purpose: to provide low-income families or individuals with no healthcare coverage information on how to apply for Medicare and Medicaid through government programs. Background: Learning Objective 1. I will prepare a manual on Word document where useful information will be provided on applying for Medicare and Medicaid. This will assist any patients or clients to go to the healthcare websites for Medicare and Medicaid in a step-by-step process where they can register for free healthcare. Learning Objective 2. I will be able to acquire experience that is relevant to my professional goals. Through this experience, I've gained new information on healthcare programs, and this enabled me to educate other staff members while doing my practicum intern, and also being able to have better communication skills with my director as far as information that I research on Medicare and Medicaid. Learning Objective 3, being able to establish leadership and networking of professionals relevant to achieve my professional goals. In doing my practicum intern, I was able to work independently and networking with different hospitals and healthcare programs and getting the correct information for Medicare and Medicaid. Learning Objective 4, acquiring organizational skills by engagement of meetings on free healthcare programs. This helped me out so much because I was able to go in there and sit down in the meetings and talk to the directors, talk to the staff members, just as far as giving me proper and the correct information on these programs. Need for the program. Learn more about the healthcare programs. That was my main focus, to learn the policies, the regulations, and also what impact will it have with the new administration and Obamacare going out, or if it's still going to be in. That was the main focus, just getting information on these healthcare programs. Product highlights. Gaining new information on healthcare. I gained so much information on Medicare and Medicaid programs that I was not familiar with. There are a lot of policies and regulations when it comes to these healthcare programs, and by doing this intern, it helped me understand which route and which direction Medicare is going and where Medicare will be in the next couple of years. Meet new staff members. By doing my intern, I made new acquaintances, I made new friends, and also met supervisors, also managers at different locations. When I was attending the meetings, I met the directors, I met the supervisors, I met the staff members, and this just gave me a better insight as far as just networking and getting to know people. The last one, attending meetings and networking. This helped me get the proper and the correct information to present and also give to my director as far as the manual and how things was developed by me going to these meetings and also getting information that was necessary to develop the manual. Literature highlights. By during the course of this practicum, we were asked to look at different types of literature. The first one I came across that was really helpful for me was early coverage, access, utilization, and health effects associated with the Non-Affordable Care Act Medicare expansion. The Patient Protection and Affordable Care Act, that was to expand Medicare eligibility for federal poverty level. The second book that really helped me get the information that I really needed to develop my manual was the Medicare coverage, affordability, and access. This was really important because it gave the importance of the Medicare and how it worked. It showed me the affordability, the access, and also the coverage for different groups. If you're single, if you have a family, this broke down all the necessary policies and regulations that you do need to be covered by Medicare and Medicaid. The next one that helped me a lot was the access and quality of care by insurance type for low-income adults before the Affordable Care Act. The article explains the access to healthcare among low-income families because we do have families that don't have any income, and there are free programs that's out there that's provided for people that don't have Social Security cards or just immigrants. There are Medicare and Medicaid programs for them that they can get covered under, but they do have to fill out proper paperwork in order for them to get those necessary Medicare services. The last one of the literature that I found very interesting was has the shift to managed care reduce Medicaid expenditure evidence from state and local level mandates. The shift to managed care reduced Medicaid. We're just talking about how things will change in the medical field, and also each state has different policies and regulations as far as Medicaid and Medicare goes. On my short reflection, my strength was creating a friendly work environment. I had so much fun working with Hope Clinic, the nonprofit, because my director also, the staff members, was really positive environment for me to work in, and I could relate, and that just made the job more easy and more experience for me. My weakness was time management, handling full-time work and school. I had a big problem with just managing both because after I was done with my full load of work, I had to go straight to the library and do my homework for my school. So just finding the balance of time management was a little bit hard for me. Opportunity, networking with different persons in the healthcare programs, that helped me out a lot because I still have the contact information. If I do need any assistance or any information, I can just reach out to them and we'll be able to get information. Trait, lack of knowledge and experience, also known when you ask for help. When I entered this program, I didn't know much about the program, but as the program was going on, and I did my research, I could get more information. Future grades and plans, continuing working for the nonprofit, educate and provide information on healthcare, working with other nonprofits, and helping out others. Comments and questions. On the YouTube page below, please indicate your anonymously preference for this practicum by clicking on these two icons. Also, please post your comments or questions in the YouTube comment section below. I will respond to your inquiries posted between April 6 and 17 to this website. Thank you for listening to my presentation. I hope you have a wonderful day. Thank you.